Today, we'll be discussing about the facial nerve. We know that facial nerve is the huge topic. So I have decided to take the facial nerve lectures in compartments. I have divided it into 2 or 3 videos. This is the first video. This video I will be explaining the basic anatomy of the facial nerve. Facial nerve is the seventh cranial nerve, and facial nerve arises from the second branchial arch. So, because it arises from the second branchial arch, it supplies all the muscles of the second branchial arch. What are the other functions of the facial nerve? The functions are: first, facial nerve, as everybody will be knowing, supplies the muscles of the facial expression. That is the muscles of the face. That is the frontalis muscle, orbicularis oculi, orbicularis oris, the buccinator, platysma, all that facial nerve supplies. And all the muscles that originates from the second branchial arch also is supplied by facial nerve. So motor supply to the muscles. Then does facial nerve have a sensory supply? Yes, facial nerve is a mixed nerve. So it also has a sensory supply. What sensation do facial nerve carry? Facial nerve carries sensation from the anterior two-third of the tongue, only taste sensation. The touch, pain, temperature is carried by lingual nerve. So facial nerve carries taste sensation from the anterior two-third of the tongue. Then also facial nerve has small sensory supply to the external auditory canal, posterior part of the external auditory canal, and a small portion of the pinna. Facial nerve carries the touch, pain, and temperature from that area. Facial nerve has one more important supply, that is secretomotor supply or parasympathetic supply to the lacrimal glands and the sublingual and submandibular salivary glands. So it helps in salivation and lacrimation. So facial nerve has these three functions. Where does the facial nerve originate? The facial nerve originates mainly from the facial motor nucleus or the proper facial nerve nucleus. The facial nerve nucleus is situated in the pons, that is the motor nucleus or branchiomotor nucleus. Branchiomotor nucleus, why? Because the facial nerve supplies the muscles of the branchial arch. That is why it is known as branchiomotor nucleus, second branchial arch. So that is the facial nerve nucleus. But facial nerve has also other supplies, no? So the sensory supply. The sensory supply is taste supply. So taste is relayed in another nucleus known as nucleus tractus solitarius. So facial nerve have connection to the nucleus tractus solitarius. Then facial nerve has a secretomotor supply. That is the salivation and lacrimation the facial nerve supply. So facial nerve has a relation to the superior salivatory nuclei or the lacrimatory nuclei. So these three nucleus. Also, facial nerve is having some small touch, pain, temperature sensation from the ear, posterior part of the external auditory canal of the ear. So facial nerve has some connection with the spinal nucleus of the trigeminal nerve for that sensation. So these four nucleus: facial motor nucleus proper, nucleus tractus solitarius, superior salivatory nucleus, and spinal nucleus of the trigeminal nerve. Facial nerve is connected to all this in the pons. So from the pons, facial nerve has to come down. Before that, let me tell you, there is an upper motor neuron. That is something that is innervating to the nucleus in the pons. That is above the nucleus is upper motor neuron. Upper motor neuron comes from the motor area of the frontal cortex, that is precentral gyrus. So from there, the upper motor neurons come. It travel in the cortico-bulbar tract. You would have studied in your physiology. Just revise your physiology. The cortico-bulbar tract, and then it comes, enters the corona radiata, and then it goes into the anterior part of the posterior limb of the internal capsule, and then it comes down and supplies the facial motor nucleus. There is one important thing that you have to remember. The facial motor nucleus has a dorsal and a ventral part. The dorsal part supplies the upper part of the face. The ventral part supplies the middle and the lower part of the face. When the upper motor neuron is innervating, the dorsal part receives supply from both sides. So right frontal cortex and left frontal cortex supply both sides of the upper part of the face, the dorsal nucleus. But ventral nucleus receives supply from the opposite side. So right side receives supply from the left frontal cortex because some fibers of the cortico-bulbar tract crosses over. Right side receives supply from the left cortex and the left side receives supply from the right cortex. So just keep this in mind. Everybody says that facial nerves are very complicated now, but let's think that we are going on a road trip with the facial nerve. We'll just see where the facial nerve is going. and we'll observe what is happening. So if you imagine like that, it is easy to remember. So it is starting in the brain. So there is an intracranial part. There has to be an intracranial part. Then you remember that facial nerve is always associated with ear as a temporal part. Then it has to come down from the temporal part. So it has an extra temporal part. So three parts are there: intracranial, intratemporal, that goes in the temporal bone, because ear is located in the temporal bone and it has an extra temporal portion. So the intracranial portion from pons, it has to come down. Another important thing is facial nerve comes out as two roots. That is a main motor nucleus, facial motor nucleus, one root will come, and the another root that is from the other paraphernalias. That is the superior cerebral nucleus, the nucleus tractus ulterior, the spinal nucleus, the sensory and secretomotor fibers together form another root. That root is little bit smaller than the facial motor root. That is known as your nervus intermedius, facial motor root proper, and the nervus intermedius together will exit the pons. Before exiting the pons, what will the facial nerve do? The facial nerve, it is due to an embryological developmental thing that the facial nerve will loop around the abductor nerve nucleus, that is sixth nerve nucleus, forming the facial colliculus. Facial colliculus forms as a bulge in the floor of the fourth ventricle, and it loops around the sixth nerve nucleus, and then it comes out. It exits the pons at the pontomedullary junction. The facial nerve exits the pontomedullary junction inferior to the trigeminal nerve and superior to the vestibulocochlear nerve. We can differentiate facial nerve from vestibulocochlear nerve because vestibulocochlear nerve is larger than the facial nerve, thicker than the facial nerve. Facial nerve is around 1.5 mm thick, vestibulocochlear nerve is around 3 mm thick. The facial nerve, along with the nervus intermedius, also known as the nerve of Risberg, cross the CP angle, and then it enters into the internal acoustic meatus. So the internal acoustic meatus is a small opening in the petrous part of the temporal bone. So the intracranial part is over. Now it is entering into the temporal part. So intratemporal portion of the facial nerve. So now it goes into the petrous part of the temporal bone. So the first segment is in the internal acoustic meatus. Internal acoustic meatus is a small opening that connects the posterior cranial fossa and the petrous part of the temporal bone. The internal acoustic meatus opening in the cranial part is known as porus. And as it comes towards the temporal bone, the fundus is formed. So the opening laterally is known as the fundus of the internal auditory canal. The internal auditory canal contains the facial nerve and the vestibulocochlear nerve. There is a specific arrangement for these nerves in the internal auditory canal. The internal auditory canal is divided into an superior and inferior portion by the falciform crest, and the superior portion is divided into an anterior and inferior part by the Bill's bar. So remember, the facial nerve travels in the antero-superior portion of the internal auditory canal. I will tell you a tip that is told to me by my professor. So imagine that vestibular nerve is posterior and 7 is always up. Remember 7 up. Remember the soft drink 7 up. 7 is always up. So facial nerve is up. So facial nerve is antero-superior. Cochlear nerve is below the facial nerve, antero-inferior. And posteriorly, you have the superior vestibular nerve and the inferior vestibular nerve. The posterior part of the internal auditory canal has lot of pores known as macular crista through which the vestibular nerves exit and supply the semicircular canals. So internal acoustic meatus is a topic for another time. So facial nerve has gone into the internal acoustic meatus and it is traveling the internal acoustic meatus from porus to the fundus. The length of the facial nerve in the intracranial portion is around 15 to 17 millimeter. In the internal auditory canal, the length is around 10 millimeter. Then at the fundus of the internal auditory canal, the facial nerve exits into the facial canal of the temporal bone, also known as fallopian canal, and forms the labyrinthine segment of the facial nerve. So inside the temporal bone, once it exits from the internal auditory canal, how to remember? So labyrinth. So it forms the labyrinthine segment. Then it forms the tympanic segment, that is tympanum. You know, remember the epitympanum, mesotympanum, hypotympanum. It's another term for ear. So hence you can remember it as a tympanic segment. Then what will happen when you have the mastoid here? It has to come down through the mastoid. So it has a mastoid segment. So these are the intratemporal segments. Meatal segment in the internal acoustic meatus, labyrinthine segment. Then you have the tympanic segment and the mastoid segment. Another point I want to say is at the level of the fundus of the internal auditory canal, where the nerve is going into the labyrinthine segments, the facial motor nerve and the nervus intermedius merge together. That is how it goes, and it enters the labyrinthine segment. The labyrinthine segment is said to be the shortest and narrowest segment of the facial nerve. It is only 0.6 mm in diameter and 4 mm in length. Also, dense arachnoid bands encircle the nerve at the fundal end of the internal auditory canal where it exits into the labyrinthine segment, and hence it forms an anatomical bottleneck. So, if there is any edema of the facial nerve, there is no space for the facial nerve to expand, causing facial nerve palsy. Hence, it is said that labyrinthine segment is the most commonly affected segment in Bell's palsy, the idiopathic facial nerve palsy. Chambo says that, but there are certain other studies saying that some studies say that tympanic segment is affected, some studies say that vertical segment is affected. I will come to that. And the labyrinthine segment travels posterior superior to the cochlea and anteromedial to the ampulla of the superior semicircular canal. The total length of the fallopian canal is 30 millimeter. So the first 4 millimeter is labyrinthine segment. At the end of the labyrinthine segment, there's a ganglion known as geniculate ganglion. At this level, the facial nerve gives its first branch, that is a greater superficial petrosal nerve. The greater superficial petrosal nerve neurons does not relay in the geniculate ganglion. Geniculate ganglion is a sensory ganglion of the facial nerve. At the level of the geniculate ganglion, the facial nerve takes a sharp turn, 75-degree sharp turn. That is its first genu or first internal genu of the facial nerve, and it continues as the tympanic segment. The tympanic segment is also known as the horizontal segment because the tympanic segment is found in the medial wall of the middle ear. It travels horizontally in the medial wall of the middle ear. That is why it is also known as horizontal segment. And the tympanic segment forms the superior margin of the oval window niche, and the tympanic segment is below the bulge of the lateral semicircular canal that we find in the medial wall of the middle ear. And then it continues, the tympanic segment continues. At the level of the pyramidal eminence, nerve bends again, forming second genu of the facial nerve or the external genu of the facial nerve. Then it goes down in the mastoid as a mastoid segment. Goes down as a mastoid segment. It goes down vertically, so it is also known as vertical segment of the facial nerve. The tympanic segment is around 11 millimeter in length, and the mastoid segment is around 13 millimeter in length. At the second turn, at the second genu of the facial nerve gives off another branch, that is a nerve to stapedius, which supplies the stapedius muscle. Then, midway between the mastoid segment of the facial nerve gives the chorda tympani nerve. The origin of the nerve to stapedius and chorda tympani nerve can be variable. It can happen anywhere between the second genu and the stylomastoid foramen where the nerve exits. After continuing in the vertical segment, the nerve exits the temporal bone or the fallopian canal at the stylomastoid foramen between the styloid process and mastoid process. That is why it is known as stylomastoid foramen, and it comes out. And it has to supply the face. As it comes out of the stylomastoid foramen, it gives the branches to the some muscles of the pinna, the posterior auricular nerve, and also it supplies the nerve to gives the nerve to stylohyoid, nerve to posterior digastric muscle. All that is given when the facial nerve exits the stylomastoid foramen. At the stylomastoid foramen, the fibrous sheath of the digastric muscle encircles the nerve and it becomes part of the nerve sheath. And the nerve is firmly attached to the surrounding structures. Then the nerve proceeds into the parotid gland. In the parotid gland, the nerve divides into two major trunks, that is temporofacial and cervicofacial, and then it forms a plexus of nerves from which 5 terminal branches of facial nerve arises. That is known as pes anserinus, that is goose foot. Goose foot it will be 5 which is attached. That is why it is known as pes anserinus. So remember that you can keep your hands like this. So here you have the temporal bone. So temporal, okay, zygomatic process, zygomatic, buccal, your mouth, buccal, marginal mandibular, that is in the mandible, and the cervical branch. These are the 5 terminal branches of the facial nerve. It supplies the muscles of facial expression. 2 more important things. I didn't explain about the greater superficial petrosal nerve. So the greater superficial petrosal nerve is the first branch given at the level of the geniculate ganglion. The geniculate ganglion is a sensory ganglion. The greater superficial petrosal nerve do not relay in the geniculate ganglion, but it exits through the facial hiatus and it goes into the middle cranial fossa. And the greater superficial petrosal nerve is the one that supplies the lacrimal gland. So it goes into the middle cranial fossa. Then it comes out through the foramen lacerum and it joins with the deep petrosal nerve to form the median nerve or nerve to pterygoid canal. I have explained this in my previous video, that is vasomotor rhinitis video. Deep petrosal nerve has sympathetic supply from the carotid plexus and they go form the nerve to pterygoid canal and go to the pterygopalatine ganglion and supply the lacrimal gland. What happens to chorda tympani? Chorda tympani is given in the which segment? Chorda tympani is given in the mastoid segment. From the mastoid segment, it has to enter the middle ear. On your surgery, you are seeing the chorda tympani, no? So it has to enter into the middle ear. It enters the middle ear via posterior canalicus and runs between the neck of the malleus and incus and exit the middle ear through a fissure known as petrotympanic fissure. And in petrotympanic fissure itself, there are other structures. I will explain about it later. But chorda tympani exits through the canal of Huger. And in the infratemporal fossa, the chorda tympani joins with the lingual nerve. So chorda tympani has two supply. Taste sensation, that is taste sensation from the anterior 2/3 of the tongue, but not touch pain temperature. Touch pain temperature is by the lingual nerve. So taste from the anterior 2/3 of tongue. Also, chorda tympani supplies parasympathetic supply to the sublingual and submandibular salivary gland via the submandibular ganglion. So it helps in salivation and in taste. Anatomy is not complete without blood supply. So what is the blood supply? In the brain, it is supplied by the middle meningeal artery. Then it is supplied by the branches of the anterior inferior cerebellar artery, that is labyrinthine artery, also petrosal artery. And then in the stylomastoid foramen area, it is supplied by the stylomastoid artery. In the parotid, it is supplied by the transspatial and superficial temporal artery. The veins also follow the same artery. And this arterial supply forms a plexus in the epineurium of the facial nerve, so that easily the blood supply cannot be compromised to the facial nerve. So because I told about the epineurium, the facial nerve has three covers. It has a endoneurium, perineurium, and epineurium. Epineurium is a nerve sheath. So this epineurium is absent in the intracranial, intracanalicular part of the facial nerve. So in that area, the facial nerve is more prone to injury. In other areas, thick three-layered nerve sheath is there. That is airbags for the facial nerve, so that minor accident and all cannot affect the facial nerve function. In the beginning of the video, I told about the upper motor neuron innervating both sides. So the thing is the supranuclear palsy. That is, some part of the facial nerve is affected before the supply reaches the facial motor nucleus. That is known as supranuclear palsy. The most common example is a stroke, internal capsule stroke. In that case, because the supply comes to the forehead from both sides, the wrinkling and the movement of the eyebrows is preserved. And the opposite side of the face will be paralyzed. That you have to remember. Infranuclear lesion, that is every crossing, everything is happened and it is cut off. So the entire area will be affected. Same side will be affected. Keep that in mind. Infranuclear, same side. Supranuclear, opposite side, and only the middle and lower part of the face is affected. Another important thing that I want to say is, in textbook and all, you would be seeing this special visceral afferent, special visceral efferent, somatic afferent, efferent. So don't get confused with it. I'll give you a tip. Afferent is arriving. That is, the sensation is arriving to us. Efferent is exiting. That is, the nerve is going to supply something. Facial nerve has what all efferents? Facial nerve has efferents to the muscles of facial expression and also efferents to the secretomotor supply, that is to the lacrimal and salivary glands. So somatic is about body wall and limbs. Visceral is organs, blood vessels, smooth muscles. All these are visceral. The supply of facial nerve to the muscles of facial expression is known as special visceral efferent. Why? It is because muscles are arising from the branchial arch. So supply of the branchial arch muscle is special. So special visceral efferent. Another efferent is there, general visceral efferent. That is a parasympathetic supply to the lacrimal submandibular salivary. So two things are there. What are the afferents of the patient? What is coming in? What is arriving? Taste is arriving. So taste is a special sense. So special visceral afferent. What other thing is coming in? Pain, temperature, touch sensation from the ear, posterior part of the external auditory canal, and the small part of the pinna is coming in. So it's general somatic afferent. Lastly, there is a small supply sensation from the nose and palate. that is known as general visceral afferent. Quick summary: it originates in the pons facial motor nucleus, and the sensation and secretomotor supply together forms the nervous intermediates or nerve of whisper, travels CP angle, enters the internal aortic canal, forms the labyrinthine segment. First geniculate ganglion gives off the greater superficial petrosal nerve, medial wall of the medullary tympanic segments. Then at the level of pyramidal eminence, take the second geno, gives off the nerve to stapedius, comes down as a vertical segment in the mastoid, gives off chorda tympani at the stylomastoid foramen exits, giving the muscular branches to the posterior auricular area, stylohyoid muscle, digastric muscle, enters into the parotid and divides into temporofacial and cervicofacial trunks and gives the terminal 5 branches: temporal, zygomatic, buccal, marginal mandibular, and cervical branches to supply the muscles of facial expression. Hope this helps. It can be little difficult. Please check the diagrams also. I will do the surgical anatomy and other disorders of facial nerve in as another video. Thank you.